I'm James Burton and I'm the Head of Continuing Healthcare Claims at Winston Solicitors and a qualified solicitor who has practiced in the area of NHS Continuing Healthcare claims and appeals for several years. I'm often asked, how do I make an application for continuing healthcare and what's the process and can I get help with it? The start of the continuing healthcare assessment process usually involves the completion of an NHS checklist screening tool. This is a document that is developed by the Department of Health and Social Care, and you can find it easily with a Google search on the government's website. So I mentioned that the NHS checklist is a screening tool. It's used by a health or social care practitioner to determine whether or not you or your loved one's needs meet the threshold to have a full eligibility assessment. The practitioner who completes your NHS checklist is required to get an understanding of your loved one's needs and to score those needs between A at the highest score down to C at the lowest in various areas of need, such as your loved one's behaviour, cognition, drug therapies or continence. A certain combination of A's, B's or C's indicates that you are eligible to have a full continuing healthcare assessment. Unfortunately, for those who don't meet that threshold, which is set intentionally low by the Department of Health and Social Care, will not receive a continuing healthcare assessment, and they can use the NHS complaints process if they're unhappy about that. Where an NHS checklist is positive and indicates that you need a full continuing healthcare assessment, the NHS should arrange that assessment within 28 days. And the assessment involves a multidisciplinary team, usually a nurse assessor from the ICB, the Integrated Care Board, and a social worker who will come together to assess your loved one. They should meet you in the process and take information from you and various sources about your loved one's needs. They will then complete a document called a Decision Support Tool, or DST for short. And the DST is similar to the checklist but requires them to go in more detail. And at the end of their assessment, they will make a recommendation to the Integrated Care Board whether or not your loved one is eligible for continuing healthcare. Some people say that they encounter difficulty even getting a checklist completed, and this no doubt stems from a couple of things. Firstly, that all public bodies struggle with resource and getting professionals with the appropriate skill to do these assessments. But also, continuing healthcare funding, in my experience, is not very well known, and you may actually struggle to find doctors or nurses or social workers who actually have the experience to be able to complete a checklist screening tool for you. What I would say is, if you encounter obstacles, there is advice out there and information that you can get. If you're having difficulty identifying a suitable health or social care professional to complete an NHS checklist screening tool, then it's possible to make an application directly to the health body, to the Integrated Care Board. That's something you can do by yourself, or it can help to have the professional support of a firm of solicitors to make sure that your application is articulated as clearly as possible, that it's evidenced in the way it should be, to maximise your chances that the NHS checklist is positive and that your loved one will get a full eligibility assessment. Many people worry when an eligibility assessment is going to take place that they're going to have to attend as an advocate for their loved one, and this can result in an enormous amount of pressure on people to perform and to ensure that they get across their views of their loved one's needs in circumstances where there's only one opportunity to do so. As a firm of solicitors, we are able to provide assistance with your multidisciplinary continuing healthcare assessment, and we can be flexible in relation to the support we provide based on your specific needs, your own skills and abilities, and your budget. So for instance, if you would like a written submission prepared to help maximise your chances of securing continuing healthcare funding, we can provide that support. At the highest level of support, we can provide advocacy services and represent you at your continuing healthcare assessment so that we can be there with you to fight for the funding that your loved one needs. If you'd like to get in touch with us for some initial advice, please don't hesitate to get in contact with us either via our website, we have a web contact form, or by telephone on 0113 320 5000.